Hello, colleagues. Today I am going to present you a case that shows what astigmatically neutral incisions are. What is astigmatism? As we all know, it is the difference in K1 and K2 readings. As you all know, side ports have not been known to cause surgically induced astigmatism, but the main port has been known to cause certain degrees of SIA as we call it. Why does the main port cause surgical induced astigmatism? So, evidence based medicine has demonstrated that any incision taken in corneas which are more than 2.2 mm in thickness have been known to cause mild degrees of astigmatism, induction of astigmatism in postoperative time. It depends on surgeon to surgeon. Some surgeons produce an SIA of around 0.5 diopters, some surgeons have 0.75, and in rare circumstances where there is wound gaping or the use of coaxial irrigation aspiration cannula, the gaping of main port is such that they can even induce 1 diopters of cylindrical power in postoperative period, which can keep patients unhappy for a long time because their unaided vision will tend to be in the range of 6 by 12 or 6 by 9. These patients never achieve a vision of 6 by 6 because of astigmatically unneutral incisions. So, after thousands of cases, I had noticed a pattern that why is it that some patients get no astigmatism and some patients get mild degrees of astigmatism. So, when I asked my professor about this, he said one should strive to make the incision in the shape of T, a perfect T. The horizontal line of the T should be the line that connects the two side ports, and the vertical line of the T should be the direction of the main port. As you can see, the direction of my side ports is completely perpendicular to the line that joins the main port. Simply put, the side ports should be exactly 90 degrees away from the main port. They can be 100 degrees apart or 80 degrees, but not more than that. Plus minus 10 degrees of placement of the side ports from the main port is allowed, but any degree further you go, you have a chance of inducing surgery induced astigmatism in the patient. These patients can never achieve 6 by 6, I must tell you. So it's better for the beginner surgeons to know this fact, to place the side ports directly perpendicular to the main port. One point to note, which I told you earlier as well, is it is always a good practice to do irrigation and aspiration with bimanual cannulas. I have just used coaxial once in my life. I always was of the habit of using bimanual for INA because coaxial cannula being thick, when you put it inside the main port, it causes gaping of the main port, increasing the chances of surgery induced astigmatism. That's all for this video. I hope you like my videos. This was a simple case through which I wanted to demonstrate you the importance of astigmatically neutral incisions. Once again, just remember to put the side ports and the main port in the orientation of a perfect T. A perfect perpendicular diagram should be there. Thank you.